Hey, folks, welcome back to another episode of the Change Physician Podcast. As your host, Dr. Kevin Cuccaro, with my absolutely phenomenal co-host, Dr. Melissa Cady, and today's returning guest, Dr. Eric Larson of the Paradocs podcast. And we have an exciting format for you today. We wanted to bring out our radio voices and figured we would spare all of you that internet bandwidth issues if you're watching this by video. So we were going to do this audio only. And Eric, it's great to have you back on the show. How you doing?
I'm doing great. Thanks so much.
Melissa, are you there?
I am here and present. And today we wanted to kind of tap into, we've talked about a few things that actually we've had a lot of great conversations, but I know that there's a lot of interest from you, Eric, about kind of where COVID is going or potentially what the future looks like for that. Would you like to kind of tap into some of your, forefront thoughts on what the future of COVID would possibly be like?
Sure. And first, sorry about my audio, or my audio is fine, but my video just being fritzy. So apologies to all you folks looking at our logos on the screen here. But to talk about COVID, I think the first thing we have to do is recognize, for one thing, it's SARS-CoV-2, right? That's to get our nomenclature proper. So when you actually have a disease or have the disease process, it's called COVID-19. So there are plenty of people we think get infected with SARS-CoV-2 who actually don't even have any signs of illness. And so they never actually get COVID-19. So just to kind of, I guess, put that out there, just to make things a little bit clearer. And the important thing, designation that is I think we need to recognize what is going to happen with SARS-CoV-2. When it comes to viruses, they either go away or they stick with us for the rest of, eternity. There are a lot of viruses that are with us right now. There are 4 coronaviruses that are similar to SARS-CoV-2. The most recent one that has come to infect humans and become endemic, which means it's with us forever, is OC43. And that came sometime in we think the late 1800s. I talked to my friend, Dr. David Graham. I actually narrated his audio or his book, From Killer to Common Cold, Herd Protection, and then Transitional Phase of COVID-19. And it's really shaped my thinking of the SARS-CoV-2 pandemic that's happened. And the important things to recognize is that SARS-CoV-2 is here with us for the rest of our lives. It's not ever going anywhere. It's never going to get eradicated. We've only eradicated 2 viruses ever. We now know there are 2 animal reservoirs for this virus, mice and mink. And unless all mice and mink are euthanized, there's no way we'll ever get rid of SARS-CoV-2. So we'll still continue to infect people as long as we have contact with mice and mink, which, I mean, surprisingly, they're actually mink farms, I guess. But, and I know mice are kind of everywhere, even when we don't want them there, right? So I guess those are important things to recognize. And so if SARS-CoV-2 is going to be with us forever, it's going to be endemic. We can't ever get to a point of 0 cases. And so it's important for people to recognize that we're never going to get to the point where no one's getting infected. We're never going to get to the point where there aren't people in the hospital with SARS-CoV-2. But probably what's going to happen is much like OC43, which is the virus that, again, I said came, we think, sometime in the late 1800s, that SARS-CoV-2, which causes COVID-19 if you get sick, will probably just become a cold. Now, it's entirely possible that if you're elderly and you're very sick, people will die from the cold who are, in their 80s and 90s from time to time, right? It will never be a 0 event. But for most people who get infected with these other coronaviruses or adenoviruses or rhinoviruses, it's just an annoying cold. Some people get sicker than others. Some people have asthma and they have problems. But essentially, when you get these infections, you get them, it's a cold, it's annoying, and you get over it in a couple of days or, maybe a week or whatever. Probably that's what's going to happen with SARS-CoV-2. And you're already starting to see signs of that when you see the differentiation between adults and children. I think that's a good way of recognizing it. Kids tend not to get very sick from this. Adults get much more sick because we've not been exposed to it at a younger age. So probably what happens with these is you get exposed to these things when you're young, so let's say OC43. And so when you experience it 2, 3, 4, 5, 6 times later in your life, you have, although not immunity, meaning you don't have antibodies that prevent you from getting infected, but you have a decent immune response through T cells or something else that prevents you from getting really sick. And so I think that's pretty much what we're going to expect to see. Now, right now it's novel, which means if you're an adult, you've never seen this coronavirus before. So you're going to be much more likely to get sick from it. But as we get exposed to it each and every time, or let's say you get vaccinated and you get at least partial immunity, you're going to be less sick from this, most likely going on. And probably there is some level of, thinning out of the herd as much as it's a kind of a morbid way of thinking about things, but some people may just be particularly susceptible to this virus. And we see that with maybe some young people and some older people, and some people for whatever reason aren't at all susceptible to it. And you probably know someone who, they had it and their spouse didn't get it and none of their kids got it. And it doesn't make any sense because they're all, in the same household together when they're probably the most infectious. And there are a lot of things we don't understand about this, but I think the important thing to know is that it's going to be with us forever. We're never going to get rid of it. We can all get vaccinated or whatever, but the vaccination will almost certainly not last your lifetime, but it'll prevent you most likely from getting really sick. And then at some point we will get back to normal living, whatever that might be. So that was a long statement.
But it brings up a bunch of important points. And the biggest one being is even, all the hype right now is around vaccination. And vaccination without a doubt is super important, and strong proponent of it. I do think the more people we can get vaccinated, the better. The faster we can do it, obviously, the better. But we also do have to recognize, just as you're saying, that this is not something that's going to go away. This is it's a virus. It's not like our typical bacterial vaccines that we have in the past, that once you have been vaccinated, you pretty much have lasting immunity forever. I kind of view this almost like the flu vaccine, and that you're going to have to probably get a yearly strain update until we can cross that threshold or that hump that you're talking about, where we as a species have adapted to this novel virus in a way similar to what we've done as a species to adapt to previous novel viruses. So, I guess that's a long way to say is don't be scared and frightened, but we're going to need to at least adapt, certainly in the near term here, like we've been doing, maybe not as stringent and stuff, but just because we get the vaccine doesn't mean that the masks are going to go away, that that everything's going to go back, quote unquote, to the way it was before, whatever that was.
Yeah. And it's funny because I actually look at things a little differently than you, Kevin. And, so I'm not confident that we'll be having booster vaccines. I don't doubt that they will exist, but I also think that probably once you've had it once or twice, or either gotten a vaccination, or you've been infected and then gotten a vaccination, or, any combination, that you probably won't need boosters at some point, because it will just become like a regular cold to you. And we have to recognize too, that we're not going to be able to vaccinate enough people. You're looking at countries now that have been really good at vaccinating their populations. We're recording this first day of March in 2021. And you're looking at stories out of like Israel is a good example, where they've gotten to about 45% of population, and they've stalled out as far as being able to vaccinate, because most people who are most excited about getting vaccinated are people at highest risk. Either people have got some sort of health condition, or they're elderly, right? 65 or 60 or so. And the problem I think we have when it comes to getting wider vaccinations are twofold. One, we don't have a vaccine that's approved for children, for one thing. So we're still going to have that vector of infection, although they probably don't infect adults as much as adults do each other. But also that we're going to have people who have 10 friends who all had COVID and they were all fine, right? I mean, I think we all know plenty of people who've had it and they were either inconvenienced or some got kind of quite sick, but most of them were okay in the end. And so, especially when you're talking to someone who's 25 years old, the likelihood that they're going to go and get vaccinated, I think it's going to be a hard sell for just the general population. You can make their life difficult and uncomfortable by saying you can't do anything. But I think, there's some implications for that too. And so I look at the safety profile of the vaccine, which is very good. But when you're looking at something that is relatively benign for most children, to say that you're going to inject them with a medication, which is a vaccine, with really no good long-term data on the vaccine. And again, they're going to probably be just fine if they get SARS-CoV-2 and get COVID-19. It's going to be really hard sell for those parents to have them vaccinated. I mean, I'm not saying there won't be some parents who will be enthusiastic, but it's going to be a lot harder slog to get that portion of the population vaccinated. And to my point is, once enough people, I think what will happen is when enough people have been vaccinated, or everyone will have the supply will have outstripped demand. And now that Johnson & Johnson's has been approved by the FDA, I think we'll get very quickly to a point where everyone who wants a vaccine will get it, and those are just people who decide not to. And I think at that point, you just say, all right, now we're just going to kind of let it fly, because the alternative is you have to sort of impose restrictions on people, which is probably not going to be very popular. And it's not going to be I don't think it'll be very productive. And we'll get, our main concern really is that we're going to prevent people from being in the hospital and being in the ICU. And if we have enough of the vulnerable population who've chosen to be vaccinated, we probably won't have that big of a problem. But again, this virus will still continue circulating, but we know it's going to be continually circulating anyway. So I think it probably won't make much difference whether we have 90% of the population vaccinated, because I don't think we'll ever get to that point. I don't know. That's just my opinion. And it's just a guess.
Yeah, I kind of agree with that, perception of really how many people are going to be getting vaccinated. And, it's interesting because you mentioned that there's 2 diseases that have been wiped out by utilizing vaccines, that I had to look up because I didn't know of this other one.
Yeah.
So, you can't tell because there's no video here. I'm sitting here looking up on my phone what those other things were. But there is, of course, I knew that we have come very close with polio, but obviously smallpox was one of the ones that was eradicated. But rinderpest.
Rinderpest. Yeah, right.
Yeah, it infects cattle. I didn't even know about that one. So anyway, for those listening, if you're curious about those too, it just goes to show you how it's, as much as we can help a lot of people with vaccines, it doesn't mean necessarily we're going to fully eradicate, and there will be an endemic position that some of these, many of these viruses will have. And like you said, Eric, is that we want to minimize the morbidity and mortality from, getting at least half, or the majority, or a majority, I would say, of the population vaccinating, assuming that the benefits outweigh the risks. So, I think it's great that you even had this much work, and I had no idea you actually did the audio on that particular publication. But when did that one come out? The Killer to Common Cold?
That came out a couple months ago.
Oh, okay. It's real recent.
Yeah, it's fairly well. I say a couple months. It might have been like fall of last year. So
okay.
It was Dave did some really great research where he just looked at other coronaviruses and sort of trying to figure out how do these viruses become endemic, right? Because at some point, the viruses that we have circulating within our populations were in another animal species and they jumped, right? And then they just became endemic. They're just around all the time. And so when do they come? And you can sort of do some investigation to figure out that the OC43, which is the most recent one, which is probably the late 1800s. And then you try and find stories that people maybe were writing about it, some sort of new thing. And of course, they called everything flu. Even though at the time, really no one knew what that was. It just was like respiratory problems. And anyway, it's a very interesting story. And when you look at how ineffective we've been at eradicating viruses, especially ones that we have extremely effective vaccines, like polio is a great example, it is really hard. And it's hard for us, especially as Americans, to really try and understand how hard it is in many parts of the world to get rid of some of these things, right? I think we think, well, why don't you just go around to all the different houses and, vaccinate all the kids? Well, if you have people living with no electricity, no running water, they're out in the middle of nowhere, what's the likelihood that the team that's going to vaccinate people happens to go at that time, enter that house when all the kids are there, for instance, or, and then the next time they go for the 2 booster doses, all those same kids have to be there as well, right? And that's assuming that everyone trusts the people who are coming in to say, I'm going to inject this into your kid's arm, or I'm going to, here's a pill for them to swallow, and you've never met me before. There's a lot of institutional trust that's required for those things. Anyway, it's a Herculean task. And even if we were, ultimately, I think the most important thing is if we get to this point where every time you get SARS-CoV-2, you get a cold, then no one cares. Then no one's going to bother getting vaccinated because who cares? You got a cold.
Mm-hmm. Right.
But and I think that's important, but I do want to call out a couple of things because I'm thinking about some of the people who might be listening to this program. And a couple of them are this. We came really, really, really close to polio eradication with Herculean efforts. I mean, it was decades and decades and decades. And we certainly don't, I in this day and age, and I want to derail the conversation, we certainly don't have the societal wherewithal to do what was required at that time. that being said, we're lucky that SARS-CoV-2 is not polio.
Right.
Because what you're touching on here is this fear of vaccination in a lot of ways. And this is not a vaccine episode. It's not supposed to be necessarily about that. But here we have a process that has the spectrum of extremes. And yet we're already having difficulty, with getting people to accept what has been, at least from the data that I have seen, a remarkably safe vaccination. And I would kind of push back that I would like to know the numbers before I made the decision on we know young people are generally spared, but not always. We've had deaths there. We know that people of all ages have had COVID-19, symptomatic COVID-19 infections, and then have long COVID syndrome associated with that. So there's some long-term sequelae that we are not aware of. And what I don't want someone to listen to is saying, oh, if you get a vaccine, great. And if you don't get a vaccine, great. And this is going to become a cold. It eventually will somehow kind of become endemic and filter through the population. But the political response and our public health response to this particular virus is going to be critically important and for the future, because this is not the only, we're never going to get rid of the species jumping when it comes to viruses to begin with. So I want to kind of put that out there, because I was getting a little impression that we're sort of almost saying nonchalant that, vaccines work, but they don't always work. And so, don't get vaccinated. I know you're not saying that, Eric, but I'm just.
No, and I think that's a really important distinction. And I have people all the time in the hospital, nurses coming up to me, should I get vaccinated? And I say, absolutely you should get vaccinated, because if I'm going to get a novel virus for the first time, I'd rather have had it the first time I get it to a point where it can't actually get me infected and cause me, great harm, right? The vaccine is extremely safe. As many millions of doses have been given, I think that there's pretty good data saying that it's a very safe vaccine. And so if I'm all worried about things, I would absolutely want to have my first exposure or my first immune response to be one to a vaccine versus the actual live virus, because I know I'll be facing that live virus a number of times in the rest of throughout my life. And so it should never be looked upon as that you shouldn't get the vaccine. I think it's an extremely good idea, but the point is just recognizing that that you're going to get exposed to it, and the vaccine probably won't last forever. And if we get to a point where every time you get exposed after you've been vaccinated or after you've been infected a couple of times, it's just kind of like a common cold. That's sort of the point. I think to your point about polio is a good one, because, if SARS-CoV-2, an infection, caused significant problems, let's imagine HIV was an airborne respiratory virus, right? And that when you faced human immunodeficiency virus, that caused all these horrible problems, without a doubt, everyone would be getting vaccinated. I don't think there'd be much question, right? Because but if there's a certain population that's susceptible and certain that's not, it's just going to change the likelihood that you're going to be successful in any sort of campaign to get people vaccinated. And that's my only point, that I think it is going to be really hard to get a certain portion of the population vaccinated. Do I think people should? I think it's prudent. I mean, I get the flu vaccine not because I'm worried I'm going to die of the flu, but because I don't want to get the flu because it's miserable, right? I mean, that's kind of how I look at it. And the flu it's probably more important to get that just because it just changes and shifts so much every year. And the fortunate thing about this is, although there are variants, fundamentally, as far as we can tell, it's going to behave like the other coronaviruses. And so you will have partial immunity, and probably kids coming up today, they will do fine. And whether the first exposure is through a vaccine or whether it's through the actual wild type and virus, they're still going to have that exposure. And so the vaccine is just a way of just doing it without actually getting, truly really sick.
Yeah,
absolutely. You're making me laugh though, Eric, because the last time I was really, really sick was in 2018. It was actually January 4th, 2018. And I remember it because I got hit, I felt like a hammer hit me, and it was the flu.
Yeah.
And so I was always laughing. Oh, people are like, oh, it's just like the flu. I'm like, holy crap. I remember my last episode of flu. I don't want to go through that again, ever. Give me I'm still waiting for a vaccine, but man, as soon as I get it, or as soon as I'm eligible, I will be jumping on that in no time at all, because man, that flu just sucked. It sucked so bad. It was awful.
Yeah, you talk to plenty of people who've had SARS-CoV-2 or the COVID-19, and it's the full gamut from the I barely knew I was sick to, yeah, it was really like I couldn't walk up the stairs and for like a week because I got so winded, or I couldn't taste food for 2 months or something. I mean, I think it doesn't make any sense why you'd be okay getting this, but I mean, it's your life, I suppose. But I mean, if it's me, I'd rather not have to go through that if I could. And I consider myself fortunate I've not had that problem. I've been vaccinated now. So I just only point out the fact that I think it will be challenging for children, especially very young children and young adults. Cause I think, just from a policy standpoint, it's just gonna be challenging, but I do think by the end of the summer, I think rationally we should get back to sort of somewhat normal activities because I think everyone will have had an opportunity to get vaccinated at that point.
Yeah.
That's the best news I think I've heard all day, because I'll keep my finger crossed on that. I was planning on 2022. I'm like, oh, we're doing the prep for 2022 to kind of break out of the chains here. But if we can do it earlier, hey, that's great.
Well, I think it's interesting because, I think it's just going to take time for the comfort and concern. And we've just been used to this kind of lifestyle for a while that it's kind of tiptoeing back into it. And I think it really, from a psychological standpoint, I think that, it's going to, certain people will be quick to jump on board the old life or a more normal, quote unquote, life. And there's others that are going to be a little more timid, I think, going into it. But, I wanted to make a comment that it's interesting how beliefs are, a big driver. And you think of, like you said, Eric, it makes the most logical sense that you'd rather, I've had people say, are you afraid when I wear a double mask and my shield and all this stuff? I'm like, no, I just don't like getting sick. Like who wants to get sick? And I thought about these people that would go to these parties to get exposed. I'm like, you conceptually don't understand like how this can be different than if you had a small little piece of RNA to expose to your immune system versus like the full meal deal, so to speak. And it just reminds me of various levels of understanding and various levels of fear or anxiety. It's just definitely beliefs and understanding. Just even the science behind this is it's so varied. So I think we're going to have a different manifestation of how people behave, even if it's July of 2021.
I totally agree. And I think what's interesting is how quickly cultural norms and societal things can shift. And so it wasn't very long before pretty much everybody's wearing a mask. I mean, whether it was mandated or not, in most places. And so I suspect it could change back a lot faster than you might think, because, we are so much driven by what we see other people doing, right? Whether it's in medicine or anything else, right? Yeah. As soon as you see someone doing something that you'd rather be doing and that they seem it's okay, right? I mean, suddenly it's okay to do. Right. I think, right. And I think, you start seeing a bunch of people, like most people have been vaccinated and most people, start walking around without masks and they go to restaurants and start doing gatherings. I think most people will be okay with that. There will be the late adopters, just like there are late adopters to whatever. Yeah. But I think a lot of people are going to be encouraged to go back to normal, because I think, to what you want to talk about later, I mean, I think the mental aspects of the hysteria, which I think is safe to call a lot of this hysteria on some level, is real. I mean, I think you're really starting to see the manifestations of it now that we're a year into the pandemic.
Yeah.
But I do hope, from a cultural standpoint, what I would like to see is that masks get a little bit more socially acceptable. Sort of, if you've ever traveled through Asia, if you're sick, you wear a mask, and it's just it's the thing that you do to spare those around you. And I don't know, I kind of like that, and I also like the fact that, like, granted, we've been isolating and doing all of that, and we don't go out that much, and we wear the mask, but it would be interesting to hear people's perspectives on sick. Like, how many people have just gotten a cold? And the little bit I've been sort of, gathering through the interwebs here and in the physician groups, which I think all of you guys are in, is just the rate of people getting sick in general because of basically social distancing or mask wearing and frequent hand washing, all this good hygiene stuff. That has dropped tremendously. So I don't want to go back to the free flowing days of the United States where we're, sneezing on our hands and then reaching out and grabbing somebody else's. Yeah, loosen it, but I would still like to see a little bit of the. I kind of like that mask. If someone's hacking and coughing and they have a mask on, it makes me feel so much better than if they didn't.
Yeah, I think there's still going to be those that shame people for wearing one because it will remind them of these days, and they don't want to.
Sure, and those people were shamed because they were shamed for not wearing one.
Right.
I mean, it's human nature, right?
I
think you're right, Kevin. I think people will be wearing masks, and I think there'll probably be there'll be a recognition of unsanitary practices, not washing your hands, not using the hand sanitizer, all those sorts of things when you're sick. But I think, we also have to think about the other side of this, because having masks, having isolation, and all these things which have absolutely diminished the amount of people who are getting sick. I mean, talk to any pediatrician and it's like night and day as far as their office. And I happen to know a pediatrician.
Yes.
There is a cost to that too, right? I mean, I think, not seeing people's faces, not having the normal social interactions has a significant mental effect on people. People who are prone to anxiety are going to become more anxious. People who are prone to be a little socially isolated are going to be far more socially isolated. And there are the effects of that too, right? There's more substance abuse, there's suicide, anxiety, depression. And, as nice as it is not to ever have a cold, would I rather have a bunch more colds and then have half as many suicides, for instance? Well, I think that's a trade-off I'd take, but it's not as easy always to just make that decision, right? But I think with everything, there's a cost and a benefit. And I think it's easy to sort of focus on one or the other, both sort of based on your bias and also sort of where your frame of mind is at the time.
Yeah, I think it keeps things in perspective that, the basic hygiene helps diminish, infectiousness to those around you. You want to kind of build your immunity too, like this trade-off you're talking about. So it's like you want to have a little bit of exposure to build an immunity, to just your basic things that aren't going to necessarily kill you. So I think there is that benefit risk of getting a little bit around other people. You don't want to be just the sterilized population in a way where you're not building immunity to things. So I think that's something to consider as well.
Yeah, those are tricky things to know, right? I think, you talk to immunologists and you ask them, explain immunology, and they're like, yeah, I can't. They're the experts, right? Because it's so complicated and we're so interdependent in our social interactions. I think it's entirely possible that you'll see people get a little extra sick next year or the year after from getting colds, because I think, we're continuously exposed to these rhinoviruses, adenoviruses, coronaviruses that we normally, get exposed, and we have this constant sort of boosting of our immunity. And by not being exposed to them for a year or two, you wonder what effect that'll have. And it'd probably be, maybe not super measurable, but I think you'll probably notice you might get a little bit more sick because you're just not around that stuff as much. And I don't know. I mean, it's real fascinating, and we'll find out what the answer is. But I always think too, when you look at the coronaviruses, the SARS-CoV-2 is specifically, with kids, again, yes, some kids get really sick and they die from this, but it's super, super rare, right? I mean, I think we have to recognize that if 500,000 Americans have died from SARS-CoV-2, it's really truly just a handful. I mean, it's almost a rounding error as far as who children have died. Tragedy for sure. But I think we just recognize that kids, for whatever reason, just don't get really sick from this. I mean, there's no question about that. And you look at T cell response for kids to other coronaviruses and other sort of common respiratory viruses, and they have usually they can determine by the age 15 or 16 they've seen them all a couple times, and so there's probably some innate sort of, I mean, our bodies are probably designed in some ways to sort of get exposed to those and be okay with them, through whether that's through genetic selection, through the centuries of living in cities or around other people or something. But there's probably some protective aspect to it, as you said, Melissa, which we don't understand. But I don't know. I mean, I think I always like to think about chickenpox. Again, that's something you just get one time, almost always. And if you get it when you're a kid, you get really sick, and then you're fine. If you get that as an adult, it can kill you, right? So, now we do vaccinate for that because, no one wants shingles when they're older, for one thing. And some kids do succumb to chickenpox too. And and it's a safe vaccine, whatever. And so we now vaccinate for that. But and it doesn't mean that at some point we won't vaccinate for this SARS-CoV-2 if we start finding that there are long-term implications to it. But I guess that's just, there's a lot of things that we don't understand. And so I absolutely think people are going to be more conscious of their hygiene in general. And I do think it's better to have people wearing masks than getting people sick, and that they're not only wearing masks because they're going to rob a bank, but it would be helpful having we just need to understand that we don't understand. I think that's probably the thing. Have some humility in the process, because I think we oftentimes make these statements that we think are, true, and then it turns out we're totally wrong. I mean, how many times do we have that in medicine, right?
Oh
where we think something's obvious, and then it's totally the opposite, even,
Yeah. So many times.
But that brings up another, first of all, we need more data, right? The answer is more data, or I shouldn't say the answer, but we'll have more of an insight the more data that we have, and the more time that we have to kind of ascertain what the effects are, the better we'll be. And going back to your point, Eric, about the hysteria thing, I think sometimes people forget that when this started, the initial reason that we were starting this lockdown wasn't because of it very quickly became hysteria, but it was because we didn't know. And we were concerned about overwhelming the healthcare system. And it's unfortunate at that particular time that things weren't framed a little bit differently. And so I'm sitting here thinking about this and rolling my eyes, because I'm not sure how you would do it, but basically say, hey, we're doing this now because this is what we're trying to get. But so many people just don't understand data. They don't understand the science. They don't understand, how science works, what the scientific method is. And it's hard to take an evolving process and continue to adapt your public messaging to that over time, when we as humans, again, carry our biases in and oftentimes don't know what is being said, or can distinguish what is being said in a way that it makes science in a long-term phenomenon. Because it would have been nice if we could say we were locking it down, we're trying to get some more data on this, and as we have more data, then we started evolving the policies in such a way, rather than this thing of what it became, where it was an ideological battle over what we're supposed to do with this, if rather than saying, hey, the science is evolving, and as it evolves, let's follow this. And I think right now we're going to still have an opportunity to just sort of see where the science goes. And it may actually be like you mentioned chickenpox. Maybe we want the kids to be exposed to it because they'll develop a better immunity. One thing about the chickenpox vaccine that I remember, and I think this is still correct, is your immunity wanes. And so while we're vaccinating kids when they're young, they tend to lose some of that immunity when they're about childbearing age, which is like the worst time that you want a woman to get chickenpox. So you got to make sure, we're adding in these sort of variables there that maybe we need to be considering for SARS-CoV-2. So.
Yeah, no, I think, the bias of where you're coming from is important. And I think, as much as we like to think of ourselves as scientists, as physicians, we're sort of scientists. We're maybe more like technicians or something like that. I'm not exactly sure what the right terminology is, right? Most of us aren't doing bench work, lab work. But I think, one thing that's become pretty obvious here is scientists are pretty bad at science. I mean, I think when you look at the amount of papers and the publications and the sort of the rush to publication, most papers that come out are really pretty close to worthless. Mm-hmm. I mean, how many times do you see scientists come out and with preprints or, not yet peer-reviewed literature, and they get, picked up by the press or whatever, and it's like totally untrue. I mean, I think you saw that with the myocarditis scare that came out that fundamentally changed a lot of the ways lots of professional and college sports leagues conducted business, with, worrying about these, cardiac MRIs that were causing problems. I've had an episode on that. And so I think the biggest problem, I think, with public health, well, two. One is that no one knows how to deal with a pandemic because guess what? We haven't had one before. I mean, so it's not surprising that we kind of are floundering, and no one in the world is used to this because we've sort of had pandemics with maybe avian flu and the SARS-CoV-2, but I kind of felt like as far as a world, global pandemic, we just haven't had one. And so the biggest problem with our public health officials, I think, is the fact that they just don't say that they refuse to say they don't know. and they speak with certainty, even when they don't have it. They say, well, this is absolutely the way we should treat it, or this is absolutely the way that we prevent it from spreading, or these are our goals, when they don't really have any reason or basis for knowing those things. Instead of saying to people, when it first came out, right, we were talking about, should we wear masks or not? I mean, a lot of people were asking that question, and we got a lot of, people were saying in the public health arena were saying you shouldn't, right? I mean, they came out and said it, whether it's from the FDA all the way down, because they were thinking, well, it's probably a good idea, but we want to make sure there are masks available for people who, in the front lines or whatever like that. And so right away we start with some mistrust, because that of course, the next thing is, well, you have to wear masks, and it's not so much. And when it comes to lockdowns, people really weren't sure what a good lockdown measure is. And there is this perception by the people making the rules that we have to seem certain about it, that we can't ever say that we think this is a good idea. We have to say this is absolutely the only way that's going to work, because they don't think people will follow the guidelines. But then if anything comes out that challenges that, then now they look like fools, right? Mm-hmm. I mean, and that's probably, and then you erode that trust, and getting trust back is almost impossible. I mean, I think that's a lot of what you're seeing right now, is you're seeing a lot of people who just don't believe what they're being told, because quite frankly, they have been lied to partially in the past. And to try and build that trust back in the midst of a pandemic, I mean, it's pretty much impossible, I think.
Well, there's a lot to explore there, though, because one of the biggest things is the difference between what we should do and what the messaging is, right? So you're talking about public health. Basically that's not even in the realm of public health anymore, is how we message things in society and the implications behind that. Because if you just kind of study the marketing of something, if you're unequivocal, people don't tend to adopt. And I'm in no way trying to argue that misleading people when saying being positive when we are not positive is the way to go. I personally think it doesn't make a lot of sense. And that if you have that degree, just like you were saying, Eric, that you say, this is the best data that we have at this point in time, and this is what we're recommending, this can change. But I do also kind of realize from the mass media perspective is that when you have those kind of shifty answers at times, things that don't provide a sense of certainty, that can be really hard for people to swallow just as well. So trust is so key. But when you have people who are on the edge of uncertainty there, and you're providing uncertain messaging, oftentimes we can worsen crisis behavior, because now there is no, then we have who knows how big of a portion of the population that is going, well, nobody knows what to do. Now we're going to just go crazy and, I don't know, Mad Max in it and buying all the masks, whatever the case may be. The other thing, though, I do think is really kind of important is about science, because science is absolutely positively imperfect. There's a lot of garbage data out there, and particularly in the medical field, if you're looking at John Ioannidis's stuff, where so many of the medical studies that we publish are just junk and not being able to reproduce. The danger, though, or at least the way I kind of look at it, is sort of like the old saying about democracy, where they say democracy is the worst form of government there is, but is better than the ones out there. And I kind of see the science thing in the same way, is we say, well, science, it's bad research, et cetera, but it's better than the other option. Because what is the other option other than trying to, at least understand, approach, validate, recognize the deficiencies, but really using a scientific process rather than, I don't know, what is the option to that?
Yeah, well, you're right, but I would just counter that right now we're not having discussions. Yep. Right. I think when it comes to the scientific community, a guy like John Ioannidis, I don't think he has the opportunity really to, in any sort of credible way, express his viewpoints and his data, people just shout it down. And there's the one way we're going to do things, and that's the only way that it can be done. Even though you may see there, in this country, there are 50 different policies, right? I mean, you could say, let's look at let's compare the different states. We have a federal system, or let's compare different countries. I think a lot of our policies, there's not much public debate for it. And I would point to the school issue is a great one, right? I mean, I don't think we're having a real discussion about. We have the public health officials which are focused on the virus and controlling the spread of the virus, which is fine. That's what they should be doing. But what you need to have is you need to say, okay, so what is the cost of whatever it is we're doing? For instance, let's say we're going to take all the kids and keep them all home doing virtual learning. Okay, well, that may be a perfectly reasonable policy, but what is the cost of that? You know, from an economic standpoint, if you're a single mother and trying to work, can you make it work? If you have decreased technology, or you don't have access to things, you have maybe now you're sort of concentrating all the people indoors in certain places. Maybe that makes things worse. Maybe you're going to set large portions of your population back 1 to 2 years in their learning. I mean, these are all costs we have to think. And then not to mention the implications of just social isolation in general, which is absolutely not healthy. We know that for a fact. No matter how introverted you are, like me, myself, you still actually need to talk to people. So you become kind of stir crazy if you don't, right? I mean, I never actually used to hang out at work talking to people. And suddenly I'm like staying off. I'm done. I'm like, instead of blasting out of the hospital, I'm like hanging out with people for about 15, 20 minutes just because I'm having a chance to talk to people. And so anyway, I mean, those are all really important things. It doesn't mean that the policy you're doing is wrong, but I think we're not having any sort of discussion about, well, what is the cost and what are the things we're losing by implementing policy X, Y, or Z, right? And I think whether it's, economic ones or whether they're medical ones, I think, you look at what happened right at the beginning of the pandemic in April. Most states, I think, for the most part, shut down their healthcare systems, right? Mm-hmm. Even though they didn't probably have any sort of reason to, in the sense that they weren't being inundated like New York City. I mean, New York City obviously had to because they didn't have any room to do anything but take care of COVID. But most of the country didn't have it or didn't have any sort of crisis. And yet they shut everything down. And now you have people, there are health effects from that, right? There's people weren't getting surgeries, weren't getting MRI scans, they weren't getting, tests for whatever, this, that, or the other thing. I think you could argue maybe some people, those things we didn't need to do. And that's, I think, another discussion we could have. But you know what I mean? I think there are lots of things that we did, which, again, we have imperfect information. I understand that, but we never really had any sort of discussion about what the implications were for the policies we were adopting. We saw what was happening in Italy and people just freaked out, right? I mean, it was like, look at Italy's blowing up their people. They don't have, ventilators. They don't have this, that, or the other thing. And so people just panicked. And without thinking about what was the implications of that. And again, I think, I feel like the biggest ones who've been taken on the chin in this whole thing are the kids, because they're the ones who need their peers. They need to be around other people. That's some of the most social times of your life. And it's going to have long range effects on that generation. I don't think there's any question about that.
Yeah, that one, I think, isn't getting the press that it needs, because if we're extraordinarily blessed in our house. Like, I have 2 kids, they're both high school students, they're both self-motivated, I mean, it's like they're almost like just like college. We don't even have to do anything with them, but that is not the norm. And just like you said, Eric, we have I'm thinking about at-risk children. We already have this sort of widening gap, and the hit that a significant portion of our population has now taken educationally at a time when education is so important to not your physical health, your financial future, the downstream effects, the societal health. That's going to be a metric that is going to be scary to watch in a lot of ways. I also think it's going to get ignored. We probably won't have a lot of good, it's not going to be the exciting stuff people are going to want to talk about, but man, that's the thing that really, really, really concerns me about all this.
Well, I mean, I think, to your point, I think actually there will be some data. I think you're going to start to see huge, massive separations in education outcomes between privately and publicly educated kids, right? There are lots of urban, most of the systems that are totally shut down are urban areas, and they've almost all been virtual. And if you have anyone who's like a kindergartner, first grader, if you take a 6-year-old and have them try and watch a movie for an hour and a half, a Disney movie, they're not going to sit there and watch the movie for an hour and a half. Usually they're going to get up 4 times and get something out. They're going to walk around. They're not going to pay attention. And for us to expect them to sit in front and watch a teacher for 4 hours, I mean, which is not nearly as exciting as a Disney movie, is is asking a lot. And so it explains the really bad educational outcomes for the really, really young kids. I mean, they're, and I think that the things that we're going to have data, because we're seeing lots of schools are in person the whole time. I've got both ends. I've got my daughter who's in college, and she's been virtual the whole time. And it's been a pretty miserable experience for her. Not only did sort of like regular college sort of experience to get taken away, but she was like isolated and in like a room by herself. She'd go down and get a sack of food and have to go back up to her room and eat. I mean, it was really truly like she was in prison. And then I look at my son, who's been in a charter school here, which we just signed up for randomly. That was sort of just the plan before this whole thing started. And he's been in person the whole time. They have, spacing and cohorting and mask wearing, all that stuff. But, from an educational standpoint, he really hasn't missed anything. And I talked to other families who've been in the regular schools around here, and it's, night and day. Or the ones who are in the Christian and Catholic schools, they've also been in person, and their education's been, not bad. And they're just doing a lot better. So I think we'll have plenty of data that are going to show it. Now, it'll be hard to sort of separate that out, because you may say, well, different populations going to these schools versus these schools. But I think there's going to be plenty of evidence that what we're doing for kids' education has been a really bad idea.
I think I kind of, I don't have children, so it's been easier for me to, it hasn't been a direct issue for me, but I've definitely seen the frustration of parents around me, and especially, tiny little babies that really need the socialization, toddlers that obviously have a hard time understanding the situation. But I'm really surprised that I didn't think, we could actually talk for an hour on this whole SARS-CoV-2, but we actually mastered that quite well.
Yeah, unfortunately, you can talk forever on this stuff, right? I mean, that's the problem. I mean, it's funny how often we talk about in the OR, because everyone's just frustrated and they want things to go back to the way they were. And I see, my wife's a pediatrician, and last week was the first time she's ever been excited to round to the hospital in her career. because well, it's funny, and that it's not funny, because the reason is because the clinic is so miserable for her, because she sees so much mental health. She's had kids with suicide attempts, and kids who their outlet was sports, and now sports is taken away, and so now they have like not, I mean, again, it's the things we're doing to our kids. I think, I don't know, I don't want to call it criminal, but I think, and sometimes I will call it criminal. I think we're just not thinking about the implications of what we're doing. Again, it doesn't mean it's the wrong thing to do, but I think we need to put a lot more thought into what we're doing as far as policies, and not to sort of blow it off like, well, it's just a year. Because for someone who's 60 and they're 61, your years, it's just a year. But for someone from 14 to 15, that's a huge difference in development, both physically and emotionally and all those things.
Right. It's kind of like that, that whole thing about the percentage of their life. So 5-year-old, 1 year of their life is like 20%. And for a 50-year-old, it's like 5%. It does, conceptually, it's different.
Totally.
Yeah. Well, Kevin, did you have any other last questions before I take us out?
No, but I just wanted to say, Eric, great to have you on the show. I thought this was very stimulating, and I know we always have a good interview when I keep wanting to continue. I'm like, man, we should just keep talking. But obviously for time, we can't do it. So really, really thank you for coming on, bringing in your excellent questions and your thinking pattern, which I really enjoy. And I also, like advocating about just being able to have a discussion and being able to step back, kind of separate ourselves a little bit from our biases, which is impossible to do, but at least we can be aware of them, so that we can actually have rational discussions about this stuff. So I really, really appreciate you from coming on the show today.
No, my pleasure. Thanks so much for having me on. It's the thing I love talking about and really hate talking about it simultaneously.
Yeah, but it must be talked about. So you are a fabulous guest as always. You always have intriguing conversations. And of course, anyone that hasn't checked out your podcast should go find the Paradocs podcast and learn a lot of these inside scoops on various types of topics. And for those of you listening, I am Melissa Cady with my co-host, Dr. Kevin Cuccaro, who has had some really great questions actually for Eric today as well. And if you haven't heard of the Change Physician podcast, make sure to check out thechangephysician.com. and join the community there. And we'll look forward to seeing you in the next episode. Take care.
Stay well, folks.